You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options, new breakthroughs in the treatment of sleep apnea. With us, we have an expert on the topic. He is Sacramento's dentist, Dr. Ludlow. Dr. Ludlow, welcome to the program.
Thank you.
We've had you on the program before, so welcome back. So for people that don't know you, and we're talking about sleep apnea today, no more CPAP. Tell us about your practice. I mean, you do a lot of things there.
We do. You know, our practice is a general practice, and we treat everybody. Pretty much the only thing we don't do is periodontal surgery, and that's just not a fun thing for me to do, and so we don't do that. But
because of the pain involved?
Yeah, I just don't like pain. So we do a lot of sedation in our practice. We do braces, fast braces for our teenagers.
So like adult orthodontics and also for younger people orthodontics?
Yeah.
Okay.
Yeah, it's phenomenal. It's incredible. We see some amazing results in a short time frame.
You really do dental implants for the denture wearers.
And dental implants and bone grafts if patients need those. In addition to smile makeovers and fillings and crowns and just our whole goal is to make sure our patients have a comfortable, great experience.
Now you are big on making, or as far as sedation.
Yes.
You do all levels of sedation.
We do.
In fact, our last interview was don't let your fear of the dentist keep you from having the smile you've always wanted.
That's correct. We do all types of sedation, from nitrous, happy, laughing gas to, our patients love just coming in and getting their teeth cleaned with
They
that.
do? They tell you, I love coming in here, really?
They do, and sometimes I think they might love the nitrous more than they love us. But
I enjoy it, I told you
okay.
that.
But we've got very, very gentle hygienists. They're wonderful. And they do great cleanings with nitrous. But then we have patients that want to come in and take a little pill before they come in, and they fall asleep to get work done, and as well as IV sedation, where we can get a lot accomplished in a short time.
And very
frame.
few people, general dentists across the country,
that's correct,
you say are doing IV sedation. Like
that's
what?
correct.
Approximately?
Maybe less than 2% of general dentists do IV sedation in their practice.
Okay, good. Okay, so let's talk about sleep apnea. First of all, how big of a problem is it? Because we're talking about not just sleep apnea, but snoring,
that's right,
things like that. But how big of a problem is it?
It's a huge problem. 1 in 4 men and 1 in 9 women have obstructive sleep apnea.
Really?
Yeah. And what happens is that people don't realize that, matter of fact, they estimate between 15 to 20% of all car accidents were caused because of someone falling asleep at the wheel, mainly due to sleep apnea. And that accounts for about 40,000 deaths and I think 6 million injuries, just from this one little problem that very few people want to talk about.
Now you say that they think they're sleeping, but they're not sleeping.
That's
what does
right.
that mean?
Well, sleep is a complex system where people go in different stages of sleep. And so you can get a lot of quantity of sleep, but if you don't get the right quality of sleep, you'll still wake up tired at the end of the night. So you could get 8 hours of sleep, but if it's really poor quality, it's as if you got 2 or 3 hours of sleep.
Okay. Now, the CPAP machine. And I asked you this on the phone, and I am a bit skeptical, but I said, have you ever had anybody that had to use a CPAP and now they're off with some of the things you do with like appliances in their mouth? Is that right? You've had that happen?
Several times.
Okay.
This is not an uncommon thing. Now, we do appreciate the CPAP. The CPAP has a great service that it provides. Unfortunately, the studies have shown that some studies show 30%, others show 50% of people that have the CPAP that just put it away in the closet and don't ever use it. And so it's one of those things, it's a problem when people don't get treated for that. Now, people come to us and we're able to get them off the CPAP. People that, I'm thinking of a patient that came in not too long ago, and his biggest concern was snoring. You know, I snore too loud. My wife's not letting me stay in my bedroom. And so he had a CPAP that he wasn't using, and he said, you know, he felt like it was just a minor problem. So I said, well, get a copy of the sleep study so we can understand how bad of your condition is, and then we can see what we can do to fix you. Well, as it turns out, his idea of a minor problem was that he was stopping breathing 77 times an hour. That is more than...
Is that right?
Yeah, phenomenal. Yeah, and so he just had an overall appearance of being tired. You know, if we could have taken a picture of it, you could really see it before and after, but we didn't think to do that. But he came in and we made an oral appliance for him. within a few weeks of him using it, you know, he was his wife was happy because he wasn't snoring any longer.
Okay.
And so we also make sure that in order for this is an effective treatment, we want to make sure they do a follow-up sleep study just to make sure.
Okay, so you're doing the check.
Absolutely.
So they go and do a sleep study, and that what measures how much sleep they're actually getting.
That's right. And
they're monitored overnight.
Yeah.
Okay. So you're saying after your therapy, what?
After we do the therapy, we have them go back with the oral appliance to the sleep lab, get a study to make sure that it's working. Because there's a condition called silent apnea, where you can take away the snoring, but still have the problem that increases your risk of heart attack and stroke.
So give me like a best case scenario. What have you seen as far as improvement?
We've seen people that were sleeping maybe an hour, hour and a half at night, now getting a full night's sleep. And so with that, it's phenomenal because all of a sudden their body's able to repair themselves, their memories improve, and so all of a sudden they have energy. They want to golf. They want to go out and do, you know, the things they used to do before this.
It's a good point. I mean, I think most of us know what it's like when you don't sleep.
That's right.
You feel lousy.
Yeah.
So these people, so they don't know they're not sleeping.
For the most part.
Because to them they're kind of sleeping.
That's right.
But they're not getting that restorative sleep, I guess.
They really feel like this is normal, that this is just part of aging. And that's what's sad is that I get frustrated because so many people don't realize they have a problem. It's not until they wait too long that and they get a heart attack or a stroke, and then it wakes them up to the fact that, you know what, I could have prevented that if I would have treated my sleep apnea.
So the way I understand this, you know, we've talked on the phone. Okay,
yeah.
So help me understand. So during the day, these people breathe pretty well. They're fine.
Right.
But when they lay down, all of a sudden they can't breathe too well.
That's right.
So obviously there's something going on with their jaw or their mouth.
That's
so
right.
you are opening it up
That's
so they
correct.
can breathe. Is that oversimplified there?
You know,
But is that kind of what's going on?
That's exactly right. So, I mean, there's different types of mouthpieces that we use in order to accomplish the end result, but the bottom line is we want to open the airway. So the airway, when it gets too narrow, the tissues vibrate and that creates snoring. But when the airway closes off, that's when we create the apnea. And so essentially, what people don't realize is that the base of the tongue forms that front part of the airway. So as we bring the lower jaw forward, it brings the tongue with it, and we're able to open up the airway when they're asleep.
What are the medical doctors saying about this?
They're referring their patients to me.
Really?
Yeah, yeah. So that, I mean, the fact is medical doctors see just what we see as well. They get frustrated when patients aren't being compliant with their CPAP. And so, you know, our whole goal is to get patients to breathe and get oxygen to the heart and to the brain. And so if we can achieve that, that's our goal. Matter of fact, in 2006, the American Association of Sleep Medicine came out with a statement that said, you know, if you have patients that are mild or moderate, they have sleep apnea, it's the treatment of a CPAP or an oral appliance are equal in their eyes. And so,
really?
Yeah. But a lot of times, patients don't know where to go, and doctors don't necessarily know where to refer their patients for the oral.
And by the way, doctors will watch this program.
Yeah.
They don't like to admit it sometimes. We'll say medical doctors. What do you want them to know about you and how you're approaching sleep?
Yeah.
And the confidence that they need to know about you?
Well, Randy, the way we approach sleep apnea is more from a scientific view.
Okay.
We look at all the different available treatments, and we want our patients to find the best options for them. And in some cases, it's not just an oral appliance. In some cases, it's not just the CPAP. We combine the two together, and we do what we call combination therapy. And it's phenomenal. You know, there's some cases where, these are the most advanced cases where the CPAP alone is not getting the results we needed, or the oral appliance alone is not giving the results we need. So we merge the two together, and they get a great experience. And they
By the way,
sleep.
have you had people that were on CPAP that even they were absolutely skeptical, and now they're sleeping fine? And does the spouse tell you, well, thank you very much, or what? Or the partner, or whatever?
We do. And matter of fact, I had a patient of mine that moved across country, and several years ago we made an oral appliance for him, and I was speaking to his wife just recently, and she said that they went on a little weekend getaway to some friend's house, and he forgot to bring his oral appliance, and so they were in a bedroom together in their friend's house, and he was snoring up a storm, and she couldn't leave the room because, you know, she was kind of embarrassed for that. She had the most horrible night's sleep, and so she wanted me to tell you and the rest of the world that These do work, and she wants everybody to get one. For her, it saved their marriage. It got them in the same bedroom again.
Did they tell you that stuff? That, hey, I'm back now in the same room with my...
Yeah, in several ways, right? I mean, one, the sound gets them back together. Because, you know, the studies have shown that 30% of happily married families, happily married couples, sleep in separate rooms, primarily from this type of
Is it mostly men that get this?
You know what? Ironically, it's 1 in 4 men, but 1 in 9 women get it too. So it's very common for both men and women.
And okay, so current treatment option, their medical doctor will send them to a sleep lab.
Yes.
They monitor them overnight. Is that correct? And then they get, and then they tell them, you know, how they're doing.
Yeah.
Is the first line therapy usually always some sort of a breathing device?
So the first line therapy is always non-surgical, right? Okay. So if somebody is mild or has moderate sleep apnea, the first line, it could either be a CPAP or an oral appliance. Okay. If somebody is severe, and that means that they're stopping breathing more than 30 times an hour, which is, you know, quite a bit.
Is that common?
You know, it's amazing how common it is. What people don't
realize. Like you see it every day?
We see it a lot. Matter of fact, people don't realize they have it, and that's one of the things that I've noticed about patients that have sleep apnea is the common theme is most people are in denial that they have it.
So if you don't have a spouse or a partner, or you live alone, you don't even know you have it. Is that true?
That is true.
Really?
That's true. And so what we try to do in our dental practice, as well as try to teach other dentists to do this is why we've gotten involved with training other dentists, because there are so many people that have this condition, and we know that we can't treat everybody. And so we've really tried to treat and teach other people so that we can raise the awareness in our field.
What about over-the-counter remedies for this? Effective, in your view?
You know, they're dangerous. And,
really?
And I want to share a story with you. A friend of mine, Luke, his dad's a dentist and should know better, but he just thought, you know, I'm making some sounds when I'm sleeping. He got an oral appliance over the internet. He boiled it in some hot water and put it in his mouth, and he wore it for a little bit. And he said, you know, it helped reduce his snoring. But what he didn't realize at the time is that his teeth were moving. He was getting gaps between his teeth. All of a sudden now, you know, his dad has got frustrated with him. He's like, I can't believe you did this, because it could have been done the right way. But he now, in order to fix his teeth, he's got to either do a full set of veneers to correct the gaps and spaces.
So they could create dental problems.
A lot of problems.
So, and they're not that expensive.
No.
Dental insurance could cover a portion of it?
That's correct. Well, actually, it's medical insurance that we go
through. So medical insurance will cover?
That's right.
How much of it?
Well,
20%, 30%?
You know, it depends on the medical insurance, but we're finding medical insurance, the reason why they're really backing this is they realize that if you don't treat sleep apnea, you find that you'll have a higher risk of a heart attack and a stroke. And they correlate that between, you know, 200 to 300 times higher risk of those incidences. So they save money by you going and get treated for sleep apnea. So they really want you to do it.
I mean, sleep is definitely, you know, we have a health talk show. There's all over the U.S. and Canada. And I have medical doctors, endocrinologists, even a psychiatrist like Dr. Daniel Amen, even wrote in his book that if you don't sleep, you know, 6 hours, 7 hours, 8 hours, the next day you're going to be tired. Like you mentioned, you know, bad memory. You could even, I guess, create like a fibromyalgia, have pain in your body from this.
Yeah, you know, it's interesting. They did a study with medical
But it's hard to believe, though, by the way, I'm sorry, that it's that effective.
Yeah.
Because it seems so simple, and people need to know this. A real interview. I'm not siding with you.
Yeah.
I'm just asking the questions here. But you're saying it is effective.
It's very effective. Okay. And that's what's so amazing about it. But, you know, going back to your point on pain, you know, they did a study with, if you interrupted somebody's sleep, they tested this on medical students. They interrupted their sleep for 3 days. And 80% of those patients, 80% of those medical students developed chronic pains as a result of it. They gave them full sleep, a lot of it cleared up. So the amazing thing is that, sleep interferes. If you don't get the proper amount of sleep, you don't get the right release of hormones while you're sleeping, your body can't rejuvenate itself.
The next day you're not, well, look, I can only speak for myself, but if I don't get enough sleep, you're not motivated. I mean, your motivation is way down.
It's true.
So do you hear stories, do you think people, they become more assertive or their ambition goes up or they're better at work?
Yeah, you know, it's...
Because this is, I guess, a bigger topic than just treating your sleep apnea with an appliance.
That's correct. So if we essentially open their airway up, they sleep better, and their lives change. And this is how their lives change. I had one patient he was in denial that he even had it. His wife told us repeatedly, we've got to get him in there because she hears him stop breathing at night. And he didn't really believe his wife so much. And I think he was a little concerned about the process.
He thought she was exaggerating?
He did.
Okay.
But he would come in, we'd do his teeth, clean his teeth, and he would fall asleep, and we'd see him stop breathing while he's getting his teeth cleaned. So we finally convinced him, you have a problem here. And he would take a nap every day. Now this is somebody that just retired, he's youthful, he's got a lot of ambitions of what he wants to do, but he wasn't really able to.
But no energy to do it.
No energy to do it. So now he doesn't take the nap anymore. Now he's golfing more, and he thanks us. He says, I didn't realize I had a problem. Now I can't sleep without this little mouthpiece. So it's just phenomenal to see those kind of results.
But people, I guess, can be stubborn about, because like you say, I mean, I only know one person that had this. I went on a school trip and we were on one of these boats outside, and he had to sleep on the top of the boat because he was keeping the whole ship up. And he told me about CPAP, and he said, I haven't worn it in 5 years.
Yeah.
So I'm thinking that guy after talking to you, I'm thinking that guy needs to try this.
Well, and what people don't realize.
Do they just not believe it? They just don't believe it that this could work because it sounds simplistic.
Yeah, I think they don't believe it. I think there's a little sense of depression that goes along with not being able to sleep properly.
Interesting. Yeah,
and so we find that when we are able to correct those, a lot of other things improve. Things that you don't even think of can improve. Like blood pressure will go down without the aid of medication. We find that people have more energy. They start re-engaging in activities they hadn't done in years. I had one patient that got back into a band before he would kind of come in dragging himself in, and now he has a lot more energy. It's just his whole charisma has changed.
So this has become mainstream, where a dentist with the right training
That's correct.
is fitting patients and opening their airways.
That's correct.
Okay. Now, is it true that, like if I talk to an oral surgeon, would he argue with this?
Absolutely not. Matter of fact,
a lot of people are getting jaw surgeries because of this.
Well, what they find is that there are some patients, when you look at sleep apnea, there's 90% of people that have sleep apnea are undiagnosed. And so as we're starting to treat these patients as they're coming in, we're finding there's a lot of severity with sleep apnea, and it's life-threatening. And so with oral surgeons, they're part of the tools that we use to help treat those most severe cases, because that's the most successful surgery that actually helps treat sleep apnea. So our patients that we're not able to achieve this with the non-surgical approaches, with the oral appliances and the CPAPs, we're able to then get them to a place where they can. And
you told me they lose weight.
That's correct.
Oftentimes.
Yeah, it's amazing, amazing.
Is it just because they have more energy to exercise, or?
Well,
what are your thoughts on that?
Well, there's several reasons. I think energy is one reason. One, they just have more energy to do things. But the other is, there was a study that was done that shows that if you're not sleeping properly, you're going to crave 22% more calories to compensate for that lack of that rejuvenation that occurs at night when you sleep. So if you're able to do that all of a sudden you're not eating more calories. Your cortisol levels are lower. You have
That's a good point. So you're stressing the body, so you have more of these stress hormones.
That's right.
To make you hold on to fat. Very interesting. Very good. So, okay, so a patient goes to see you. Yeah. What do they ask you every time? Like, what does that sound like?
Yeah. Does this really work? It sounds too good to be true, And
what do you say?
And what we say is, we have a very, very high success rate, and these do work.
And do you have measurements? So on that consult, can you pretty much tell them with a certain amount of certainty, you're a good candidate, you're not a good candidate?
What we do is we have them come in, and we have a machine that uses sound waves to measure their airway. And we put their jaw in a mock position to see if an oral appliance could work for them. And that lets them know right away whether we can get successful treatment or not.
What about comfort?
They're
Tough?
They're very comfortable, believe it or not. Matter of fact, they're so comfortable. I have patients that they're worried if when they forget it, they have a hard time falling asleep. We have some patients that do a lot of international business travel, and you can't bring your CPAP on the plane with you. And so they can bring their mouthpiece, they put it in, and they have a good sleep as they go to Asia or go to Europe.
So how soon, by the way, do they start seeing results? Okay, so they come in, and what's the turnaround time? Okay, so you know they're a candidate.
Yeah.
You take molds of their mouth or whatever you do. How soon before you get that appliance and start sleeping?
Usually about 2 weeks. It takes about 2 weeks to get to do all the measurements and get the new device in for them. And then really to get really good results, we see it within about a month.
Any miracle stories where they call you in a week and say, "Oh my goodness"?
We have, and that's what
snoring is gone, or
there's
the wife's not complaining.
we had one patient that was very skeptical. She said, we treat her husband, and so she was still skeptical, even though she saw the difference we did for her husband. But they were going on a trip to China, and they wanted to they didn't want to get 2 rooms when they went to China in all their travels, and so her son wanted her, because she snored very loud, wanted her to get a sleep appliance. And so she came in, and we were really cutting it down the wire. We rushed the lab to get it in, and because we wanted to make sure it was ready for her trip. And I told her, I said, it's not fully titrated yet, but at least you can have this and let me know how you do on your trip. So she comes back a few weeks later after her trip to China, and she said, you know what? My son didn't complain once. We shared a room, and we could physically see a change in this woman. And
like what?
I mean, before she was we would deliver the appliance.
Just tired looking.
She looked very tired, and matter of fact, she would kind of nod off as we were even talking to her, right? So she was very tired. Now she came in after with a little jet lag, but even with that, she was a lot more alert.
Okay, now you used the word titrated. Does that mean you're adjusting this?
That's correct.
So it's not just one solid piece.
That's correct.
Oh, okay.
So what we do is if you described that essentially the way we do this is that we move the jaw forward. If you move from point A to point B really quickly, the jaw muscles can go into spasms and you have problems. And that's what we find with people that haven't had enough.
That's why it could take a month.
That's right.
You're slowly.
That's right.
Interesting.
So if we can slowly adjust the jaw, the body gets used to it, and the patients are really happy.
Of your practice, because I know, look, I mean, I don't know, but you've told me you take care of denture wearers.
That's
right.
Kind
of a no more denture. You do sedation for the highly anxious. Is this one of the happiest group of patients, by the way, when you could get people back to sleep and off that CPAP?
You know, it's incredible.
Where do you rank this amongst?
This is top. This is top.
Really?
Yeah. I mean, it's wonderful to change a smile, and it's wonderful to change a life. When we change their smile, but it's incredible when we change all aspects of their life, and that occurs when people sleep better, and we literally extend their life, and that's what's amazing. You know, in addition, they're able to do, because of the added energy that they have, they're able to do the things they've always enjoyed doing. They're back to playing golf on a regular basis. They don't have to, their life isn't interrupted or centered around a nap any longer.
So in Sacramento, because I know you train, or you told me you train other doctors on doing this. There's not a lot of guys doing this?
There's not. You know, there are a few that kind of dabble here and there, but there are not a lot of people that do this.
And we are out of time, but what should somebody look for then in a dentist, in your opinion, that's doing this, that's making appliances, that's treating sleep problems?
Well, I think it's really important to talk to them and ask them, you know, what is their success rate? You know, how long have they been doing this? I think one of the other keys is to find out, are they comfortable working with a combination therapy? Are they comfortable?
What does that mean? What does that mean?
Well, that means that you're combining the CPAP and the oral appliance together.
Okay.
So that really helps us treat the most severe type of patients that have sleep apnea. And so, you know, one of the things that we find, if we can treat these patients, you know, they get up less at night, go in the bathroom, they sleep better, and it's just, it's incredible the type of lifestyle that they change.
Now, respectfully, I'm saying, does the appliance do all the work though? I mean, how much training do you actually need?
You need a lot, because
I mean, are you that much better now than you were a year ago?
You know, it's amazing how the more patients you treat, the more situations you see, that it really, experience does make a difference in this area.
Now, is it true that because I did a little bit of research, my due diligence here.
Good.
But and certain dentists think, Randy, oftentimes they need their whole mouth rebuilt.
That's correct.
Which may cost $30,000 or $40,000. Yeah. Where do you stand there?
Well, the fact
bringing the teeth in a way where you, I guess, really in combination. What are your thoughts there?
It's funny you should bring that up because there are situations where that is warranted. We had one patient that her mouth was very closed. So if you were to look inside the mouth, if we could get a little camera inside, we'd see the square footage inside the mouth very, very small, forcing the tongue backwards to block the airway. Okay. So simply by just opening her mouth and teeth that were worn down, we were able to open things up. We found that it gave the tongue a place to go other than the back in her airway. And so there were situations where, in her case, every day before she'd make dinner, she'd take about a 2-hour nap, so she had the energy to then move forward to the rest of the evening. This is a very successful person. This is someone that's an executive. This is not someone that doesn't take care of themselves. And so we were able to open her mouth and also get a mouthpiece in addition to that to help give the combination that she needed to get rid of that nap every day and get rid of all those episodes of her not breathing properly at night.
So like anything else in life, or I should say in medicine or health, that early treatment is better. So if you catch somebody early when they're just starting to get...
Just when they're snoring.
Told you're you're snoring a lot, so you're snoring more.
That's right.
So you get this done early.
Yeah. So
to make it easier on you, easier on them.
Well, the earlier that we treat the intervention, the less damage it does to our body, right?
Okay.
So there's studies that show that if patients are borderline diabetic, if they have sleep apnea, it's uncontrolled, it will push them into full-blown diabetes. There are patients that are doing damage with high elevated blood pressure. They find that 86% of patients that have resistant blood pressure to medications have sleep apnea, and they should be treated for the sleep apnea.
Interesting. Okay, final message. Somebody watching this, they want to know more. They're skeptical, and I'm still a little skeptical, but if what you're saying is true, it seems like everybody should give it a shot.
Absolutely.
So what do you say to them?
I say, if you have been told that you have sleep apnea, or if you've been told or if you have a CPAP in the corner that's collecting dust, and you've been told that you have it and you're not treating it, I suggest getting treatment right away.
Okay. I want to thank you for coming on the show. Very good.
Yeah,
very good. We're out of time. If you'd like to see this interview again online, you can visit our website at wellnesshour.com and just put in sleep apnea, or you could put in Dr. Ludlow. You'll find him there. I'm Randy Alvarez. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.